I would like to introduce our speaker today, Dr. Lynn Deitrick. Lynn Deitrick is an assistant professor at the University of South Florida and faculty member of the Florida Caribbean AIDS Education and Training Centers. She has more than 30 years of healthcare experience, spending the last 13 years as a nurse educator, researcher, and writer. Dr. Deitrick has developed and presented educational sessions for topics on HIV, spoken at national conferences, and previously prepared 2 online educational modules for hospital staff. In addition to her wealth of knowledge and clinical education experience, Dr. Deitrick has published 25 peer-reviewed journal articles. She holds a doctorate in applied medical anthropology from the University of South Florida. Dr. Deitrick, I'd like to turn it over to you.
Thanks very much, Suzanne. Okay, these are the learning objectives for today's session. At the end of this session, you'll be able to explain the CLAS standards, describe what the standards mean for patient care, and describe how CLAS standards impact our care of people living with HIV. Okay, first of all, I'd like to start out by telling you what CLAS is the acronym for. The National Standards for Culture and Linguistically Appropriate Services in Health and Healthcare is what the acronym CLAS stands for. And as we start, I'd like you to listen to the following quote by Dr. Martin Luther King Jr., which is going to give you the framework for why the CLAS standards are important for us to know about. And the quote goes as follows: "Of all the forms of inequality, injustice in healthcare is the most shocking and inhumane." Okay, so keep that quote in your mind as we talk about the national CLAS standards. So as we look at what the acronym means, notice what the first 2 words are. The first 2 words are culture and language. And as we learned in the quote from Dr. King, health inequities in our nation are well documented, and the provision of culturally and linguistically appropriate services, framed as the CLAS standards, is one strategy to help eliminate health inequities. By tailoring services to an individual's culture and language preference, health professionals can help bring about positive health outcomes for diverse populations. The provision of healthcare services that are respectful of and responsive to the health beliefs, practices, and needs of diverse patients can help close the gap in healthcare outcomes. The pursuit of health equity must remain at the forefront of our efforts. We must always remember that dignity and quality of care are rights of all and not the privilege of a few. Adoption of CLAS can improve an organization's ability to address healthcare disparities. So the purpose of the CLAS standards then is to advance health equity, improve quality, and help eliminate health disparities. So think of the CLAS standards as a blueprint or a guideline to help organizations and individuals learn how to provide culturally and linguistically appropriate care. So what are the national CLAS standards? Let me give you a little bit of history. The CLAS standards were first published by the Department of Health and Human Services, Office of Minority Health, in 2000. They provided a framework for organizations to best serve the diverse communities in our country. They underwent an enhancement from 2010 to 2013, and then they were relaunched as the Enhanced CLAS Standards in 2013. And we're going to be talking about the Enhanced Standards today. And the CLAS Standards basically came out as a response to the National Civil Rights Act, also known as Title VI, that was passed in 1964. And the National Civil Rights Act, or Title VI, basically requires all entities receiving federal financial assistance, including healthcare organizations, respond to the needs of people with limited English proficiency. And it basically is designed to ensure that people with low English proficiency have meaningful access to healthcare services. So the CLAS standards, as I said, were first developed in 2000. Originally, there were 14 standards, and then later the standards were enhanced and ended up with 15. So the new standards there are 15. Now here's a comparison chart to show you what changed. So if you look at the column on the left, you'll see the expanded standards talk about definitions of culture, the audience, health, and recipients, the original standards in 2000, and then the new standards in 2013. And the main thing is that they refined the definition of culture and they defined the definition of health. And they included expanded the definition of health to include physical, mental, social, and spiritual well-being. And they expanded the definition of culture to include geographical, religious, spiritual, biological, and sociological characteristics. So that's important to understand as we go forward in our discussions. So the enhanced standards are intended to inform, guide, and facilitate practices related to culturally and linguistically appropriate health services. And while many of the standards speak to organizational level changes, it's important for everyone to know about the standards and work to ensure that all patients receive health care services that are culturally and linguistically appropriate. So if you think of the standards as a blueprint, and implementation of the CLAS standards is essential in order to effectively respond to issues related to quality of care, changing demographics, the marketplace, disparities, legal mandates, and liability risks. And the enhanced standards consist of 192 pages that gives each of the 15 standards plus suggestions for implementation. So the CLAS standards are organized around what we call the principal standard. And this standard explains the overall goal of CLAS. As you will notice, the components of the CLAS standards include culture, language, health literacy, and communication. And we're going to review all of these topics briefly today because we need to make sure that everybody has the same understanding of all of these topics to serve as a framework for the CLAS standards. The key word on this slide is partnership. CLAS standards encourage organizations and individuals to work together with their patients and communities to create a linguistically and culturally sensitive healthcare environment. And this not only means that we should learn about each other's cultures and become more culturally aware, but it also means we really need to understand who our patients are, where they live, and then go out there, seek out the leaders of those communities, and co-create what we want our organization to look like. So it's a partnership designing a culturally and linguistically sensitive organization together. So why are the CLAS standards important to us as HIV professionals? Well, if you look at this map, in 2013, 35 million adults and children were estimated to be living with HIV worldwide. That's huge. You can see from this map that no place is spared. HIV is everywhere. The worldwide reach of HIV underscores the need for health professionals to be trained to work effectively with patients from other cultures, and the CLAS standards provide a framework for doing this. So let's take a look at HIV data in the U.S. This slide illustrates that in 2012, although African Americans make up 12% of the U.S. population, they accounted for almost 47% of the diagnosis of HIV infection. Whites make up 63% of the population, but accounted for 28% of the diagnoses. And while Hispanics and Latinos made up 17% of the population, they accounted for almost 21% of HIV diagnoses. And to look a little further, let's look at the status of immigration in Florida. This slide here points out the diversity of our state and also points out the need for the understanding of cultural and language needs of our patients. So the first word in the CLAS standards is culture. There are many definitions of culture out there. This one is an easy to remember definition for culture, the things that bind a group of people together. Geography can play a role as well. People from the same area or the same country may share some or all of these components, but not always. Also, there are organizational and professional cultures such as medicine or nursing, each with its own customs, languages, beliefs, and traditions. And it's culture that distinguishes us from our closest relatives, the great apes. Culture influences many aspects of people's lives. Disparities refer to differences between groups of people. These differences can affect how frequently a disease affects a group, how many people get sick, or how often the disease causes death. Health disparities can be magnified based on some of these things listed on the slide. Culture impacts both personal history as well as the wider situational, social, political, geographic, and economic factors. For example, in some rural areas, we may have patients, men having sex with men, who may not be comfortable opening up about their sexuality or HIV status, and this discomfort could impact their ability to seek care or stay in treatment. So we have to be very responsive to our patients and understand that geography, politics, all of those things impact people and their health-seeking behaviors and decisions. Part of the goal of the CLAS standards is for people and organizations to become more culturally aware. So how do we become more culturally aware? By engaging with others in a purposeful way. So here's the process. Start out with respect for everyone and all cultures. Communicate. Ask about preferences or customs. Understand. Try to understand other points of view, the way other cultures look at the world. Engage. Engage everyone and be curious about people and cultures. Gain comfort and experience talking with people about culture and cultural differences. You won't know unless you ask. So the framework for cultural awareness at an organizational level has 5 components, as you can see on this slide. Cultural awareness must be manifested at all levels of the organization, including but not limited to policymakers, administration, clinical staff, frontline staff, greeters, everyone. And part of the element of organizational cultural awareness includes knowing the community your organization serves. For example, do people from the local community and cultures work in your organization? Do some staff members speak the languages spoken by the people in the community? Do you know who the key leaders are for the various cultural groups in your community? Are there special religious or cultural customs that are important for your patients? For example, if you have Muslim patients, do you know when Ramadan is? And do you know that your patients might be fasting during daylight hours during that month? And as an example, it's important to know that Muslim patients fast for a whole month during daylight hours during Ramadan, because if they're on oral HIV medication that has to be taken with food, they may just decide to skip taking the medicine. So it's important for you as the provider to know about Ramadan, know when it is, and discuss with your patient ways to make sure that they can take their medication without compromising their religious practices. So all of this, and patients aren't going to think about this. Patients are just going to know it's Ramadan. They're going to fast. So it's up to us to be sufficiently familiar with our culture, with the culture of our communities and of our patients, that we can anticipate these things and have the conversations that are important. So all of this kind of information is important in developing a cultural awareness framework for your organization. It's also important for health professionals and providers to become culturally aware. Again, going back to our example of a Muslim patient who is fasting during Ramadan, it's essential that you discuss with your patient alternative ways to take medicine. Also, it's important to know that many faith traditions have fasting days. Muslims have Ramadan. A lot of Christians fast on Good Friday. Some Jewish people fast on Passover. and on and on. So it's important as health professionals to know when these important traditions happen and how can we help our patients maintain their health, take their meds, and still respect their cultural traditions. Another example is pork insulin. Some cultures and faith traditions prohibit eating pork and pork products. Therefore, if you have a patient on insulin, and if you know that they're Muslim or Jewish, you're not going to want to give them pork insulin because pork is against the dietary laws of their particular religions. So knowing the cultural and faith traditions of your patient is essential, and the CLAS standards acknowledge that, and they provide a framework for this. Besides basic cultural information, it's also important to know other things about the people in your community. It's important to know about the effects of migration, racism, poverty, and discrimination that people from different cultures might have experienced, and also the incidence and prevalence of HIV or AIDS in the population is also important to know. Along with this, providers should understand concerns about disclosure of HIV status within certain cultures and the stigma that may be associated with HIV. As an example, we've been watching the news about the turmoil in the Middle East, and we've seen that in the Middle East, people that have been identified as homosexual are being thrown off the roofs of buildings to their deaths. So therefore, if you have a patient from that part of the world who has HIV, they may be afraid to disclose because they know what happened in the Middle East to people who were practicing homosexuals. And so they really have to, build trust. So it's important for us to learn this. And finally, trust is a key component of cultural awareness. Patients want to trust their healthcare providers. One way we establish trust is to really build relationships and acknowledge that our patients' cultural traditions are important. Worldview is an important concept when we talk about culture because we've all been brought up in one culture or another. Worldview doesn't change. This is the basics of what we believe. Worldview impacts how we see the world and make judgments. It's not based on skin color, but culture. The concept of lived experience is important to keep in mind when we talk about worldview because what it means is one needs to experience something to really understand. As an example, let's use HIV. Unless you have HIV and have experienced the stigma of having it and having to disclose that you have it, it's hard to really know what people living with HIV are experiencing and how this can impact their thinking about health care. Language is the second letter in the CLAS acronym. We're going to take a few minutes now and talk about language. The language you speak at home impacts your view of the world. For example, if you speak a language that has words such as masculine or feminine, this can impact your views on gender and conceptions about gender. Language can also be a barrier, especially if we can't speak the language of those around us. And as our country becomes more diverse, this is a major problem. We have lots of people who speak different languages who may not be proficient in English. Similarly, there are professional languages such as the language of medicine, science, nursing, and other disciplines. So for people who don't speak medical, the language and words can be a mystery. So think about how this can impact our work. Language can create barriers for people seeking health care. And put yourself in the position of a patient. Pretend you're living in France and you've got to go get health care. You don't speak French. What are you going to do? And how is that going to impact your decision to seek out health care? So it's really important to keep this kind of thing in mind as we're dealing with our patients and thinking about implementation of the CLAS standards. When we talk about language, we also want to talk about communication variations that impact communication. For example, when we talk about conversational style and pacing, this includes things such as speaking fast or slow, use of hand gestures, and similar things. Personal space. Different cultures have different culturally acceptable ideas about the distance two people should be from each other when talking. Think about the expression that we have in this country of being in your face. In some cultures, it's acceptable to stand very close when you're talking to others. In some cultures, it's not acceptable to stand close together. Eye contact is important. In some cultures, it is considered rude to make eye contact, especially between women and men, professionals and clients, and doctors and patients. This has to do with deference and modesty in some cultures. And I want to talk about this for a couple of minutes. You may find that you have some patients that don't make eye contact with you. And this is often having to do with respect. And also, what it means is if they're deferential to you and they're not making eye contact, they also may be reluctant to ask questions, even if they don't understand, because some cultures consider it disrespectful or rude to ask questions of the healthcare provider, because the healthcare provider is considered a person of great respect that should be shown deference. So just because your patients don't look at you and don't ask questions, it's very important for you to understand that may be a cultural matter. Touch is also important. And whether or not you can touch someone, like put your hand on their shoulder, hug them, pretend to kiss, all of those things, they're acceptable and expected in some cultures, others are not so. Time orientation is another thing. In some cultures, people are casual about time, and this can result in being late for appointments. So if you have people that are continually late for appointments, it may not be that they don't know how to tell time. It may just be that in their culture, being punctual is not important. And then the concept of gender norms. This has to do with female modesty, chaperones, and even sometimes men taking care of male patients and females taking care of female patients. So if you find a patient where they want someone in the room with them when you're doing a physical exam, in some cultures it's expected that there's going to be a chaperone to protect someone's modesty. Okay, so it's really important to understand that. And then the last thing is gestures. And I want to spend a few minutes also to talk about gestures. In our culture, it's very common to give gestures like thumbs up, the OK symbol, point, things like that. Well, in some cultures, pointing can be considered rude, and thumbs up can be considered an obscene gesture. So you really want to be careful about that. Also, in some cultures, you don't shake hands with the left hand because in some cultures the right hand is for eating and the left hand is for toilet. And so the left hand is never used for eating food or shaking hands. It's considered unclean. So again, things like hand gestures are important, and you really need to learn, as both an organization and an individual, some of the cultural norms of your patients, not only as a sign of respect for them and their culture, but also so that you can create a level of trust and understanding. And if you remember the key aspects of cultural awareness, respect, communicate, understand, and engage, you will be able to bridge the cultural differences between yourself and your patients. So let's take a look at the impact of language in our country. If you look at this map, you'll see that there are many areas of the U.S., including Florida, where English is not spoken at home. This means we as healthcare professionals need to be aware of the possible language barriers that may exist with our patients and work to ensure that such barriers do not affect a person's access to healthcare. So if you look at the areas in pink are Spanish, and it's broken out by county, and it shows counties where at least 10% of the people speak a language other than English at home. So you can see Spanish by far is the largest, and then after that you have Native American languages and so on down the list. Next, let's take a look at some statistics related to language and healthcare access in the next few slides. This slide shows the breakdown of different minority groups in the U.S. as of 2005. And the country is getting more diverse, and that's why the CLAS standards were developed, and it's also why they were enhanced so to respond to the changing diversity within our nation. This chart projects what the U.S. population will look like in 2050. And you can see that the biggest increase will occur within the Hispanic population, and so therefore we need to be responsive to those changes. This chart shows you that many people speak languages other than English at home. And it's important when we talk about the language spoken at home, what that means is people usually speak at home the language they're most comfortable in. So even though someone may be bilingual and may be fluent in English, when they're ill and they have medical needs, they're going to be most comfortable and understand best in their own native language. So don't assume that just because someone is fluent in English, that that's the language that they're most comfortable in when they're in a stressful situation such as in a healthcare situation. We often talk about patient satisfaction, and a lot of organizations have benchmarks that they're required to attain in patient satisfaction in order to get reimbursement, and that's especially true in hospitals. So this graph shows patient-centeredness, and patient-centeredness is a good indicator of patient satisfaction with care. And this chart shows the level of satisfaction with healthcare services based on the language spoken at home. Another important indicator of patient-centeredness and satisfaction is based on the patient perception of communication effectiveness. And again, notice I said the patient perception of communication effectiveness. Okay, so it's not only the feeling that the doctor listened to them, but also understanding everything the doctor said. And people aren't always willing to admit that they don't understand. They may be embarrassed that they don't have a better command of English or that they don't speak English at all. This chart provides some interesting statistics about access to care for Hispanic patients. And if you look at the light blue block, which represents Hispanics, you'll see that a surprising number access care at community health centers, and another large amount have no regular place of care. So you'll see that we really need to be responsive to the needs of these patients. And this next chart, it talks about the perception of personal health status and how that differs among minority patients. Okay, so this is another graph that's pretty telling. So as we've discussed, culture and language are key aspects of patient satisfaction with care. The CLAS standards were developed in response to the statistics we just reviewed in order to give organizations and individuals guidance on how to improve access to care for everyone, regardless of their country of origin or native language. Now that we've talked about culture and language, let's take a closer look at the CLAS standards. As mentioned earlier, the standards are organized around this principal standard. You'll notice, as I mentioned earlier, that the key components include culture, language, health literacy, and communication. After we discuss the standards, we're going to talk briefly about each of these components and how they serve to enhance the reach of the CLAS standards. So the CLAS standards are organized into 3 themes that provide guidelines for improving cultural and linguistic competency in the healthcare system. These themes are broken down into the themes of culturally competent care, language accessible services, and organizational supports. Besides being a conceptual framework, the CLAS standards provide specific recommendations for addressing inequalities at every point of patient contact in the healthcare system. Okay, so let's look at Theme 1. Theme 1 looks at governance, leadership, and workforce, and encompasses standards 2 through 4. And these 3 standards together really comprise cultural competence and developing a plan for implementing cultural competence and cultural awareness throughout the workforce. This theme deals with the importance of the implementation of CLAS as a systematic responsibility, requiring the investment, support, and training of all individuals within an organization. And if you look at Standard 3, notice it says recruit, promote, and support a culturally and linguistically diverse governance, leadership, and workforce that are responsive to the population in the service area. What this means is you need to know your community and make an effort to recruit, hire, and retain people from the community into your organization. Because when people come for health care, they want to see people that look like them and sound like them, and that's going to make them more responsive. And then also you can see that there should be ongoing training for staff and leaders about the CLAS policies and practices on an ongoing basis. Now look at Theme 2. Theme 2 deals with communication and language assistance. Standards 5 through 8 talk about the recommendations for healthcare organizations for addressing language and other communication barriers to adequately meet the needs of people with limited English proficiency. This theme covers the understanding and application of appropriate services to include the communication needs and services not only of people with limited English proficiency, but also include sign language, braille, oral interpretation, and written translation. And these standards in this theme harken back to Title VI in the Civil Rights Act of 1964, which requires all entities receiving federal funds, including healthcare organizations, take steps to ensure that people with limited English proficiency have meaningful access to health services. So let's take a minute and look at these 4 standards because they're very important. So number 5 talks about offering language assistance at no cost to the patient. Okay, so that means that they're entitled to translator, interpreter, whatever they need at no cost to themselves. Standard 6, all patients have to be informed of the availability of language assistance services clearly and in their preferred language, both verbally and in writing. Standard 7 has to do with interpreters and providing language assistance, and important to understand that the use of untrained individuals and or children as interpreters should be avoided. And number 8 talks about providing easy to understand print and multimedia materials and signage in languages commonly used by the populations in the service area. And we'll be talking a little bit more after we review the standards about language assistance, since it's really at the heart of the CLAS standards. Okay, Theme 3 has 7 standards. So I have 3 on this slide and then 4 on the next. So Theme 3 focuses on the organizational supports necessary for the adoption, implementation, maintenance, and evaluation of culturally and linguistically appropriate policies and services, regardless of one's role within an organization or practice. and all individuals are accountable for upholding the values and intent of the national CLAS standards. Okay, and notice it also deals with evaluation. So it's basically the plan, do, study, and act cycle integrated as a way of continually reviewing and refining language services. And the last 4 elements of Theme 3 really focus on partnership. And the 4 standards focus on the development of partnerships with the communities we serve. These 4 standards provide a blueprint for establishing community engagement and include recommendations on conducting community assessments. Okay, so part of it has to deal with transparency. If you don't have the language services now or you want to improve them, ask the people in the community. Ask your patients what would be helpful to them. Maybe even invite people from the community to work with your staff to help come up with a list of what are the best ways and what are the most immediate needs for language services, and make that as your starting point. But Theme 3, the last 4 standards, deal with partnerships, and it's important to understand that. We need to partner with our communities in order to meet the needs of our patients. So as we next discuss ways to implement CLAS, I want to reiterate the importance of culture and language in people's lives. Also remember that a person's native language is usually their language of choice when they're receiving medical care. So how do we implement the CLAS standards in our workplace? This chart gives examples of the supports necessary to implement language support in an organization. Linguistic competence is the capacity of an organization and its personnel to communicate effectively and to convey information in a manner that is easily understood by diverse audiences, including people with limited English proficiency, those who have low literacy skills or are not literate, individuals with disabilities, and those who are deaf, blind, or hard of hearing. Linguistic competency requires organizations and providers to respond effectively to the health and mental health literacy needs of the population served. And the organization must have in place a policy, structures, practices, procedures, and dedicated resources to support this development of language services. So what does effective organizational communication look like? This chart illustrates the importance of effective communication at every point of contact in an organization. Speaking the same language is not enough. You need to ensure that the understanding is the same. Think about your work setting and how effective communication might be enhanced using this chart as a guide. This is part of what the CLAS standards are meant for, to help us make our work settings more open and welcoming to all. Remember, too, that many professionals have their own language, particularly medicine. Do not use medical jargon when talking to patients. Don't assume they understand. Just because they nod their heads or appear to be listening doesn't mean they get it. As part of effective communication, it's also essential to understand that many people are anxious, worried, and afraid of going to healthcare settings. Even those who are health professionals themselves can have difficulty communicating when they are in the patient role. You might want to use methods such as a secret shopper to traverse your workplace from door to door to see what a patient might encounter. This can then provide insights on what might be needed in order to enhance communication in your workplace. You can also invite members of your community to participate in this secret shopping and look for their recommendations as how to make your facility friendlier to the people who are going to use it. And we're going to spend some time talking about interpreters and communication. Interpreters are a vital part of communicating effectively with our patients. Language is a critical element of the CLAS standards, and optimal communication is essential in providing quality care for everyone. Language barriers can result in problems such as misdiagnosis, noncompliance, medical errors, longer hospital stays, more complications, and the list goes on and on. It's important to offer and provide language assistance services, including bilingual staff and interpreters, at no cost to each client or consumer with limited English proficiency at all points of contact in a timely manner during all hours of operation. It's important to also ensure the competence of this language assistance provided by interpreters. French should not be used to provide interpretation services except on request by the patient. While live face-to-face interpreter services are ideal, this isn't always possible. Telephone interpreter services, also called language lines, can help bridge the language needs of patients. And video interpretation services are also available and can be especially effective for communication with patients who are hearing impaired. And the best programs have a variety of approaches. So they may use bilingual staff, they may have interpreters, and they may also use language lines. So it's important to develop a system that works well for your organization. This slide has pictures of universal health symbols that have been developed to help people navigate the healthcare environment. And these symbols are becoming used internationally in healthcare settings all around the world. A picture really is worth 1,000 words. In healthcare, it's important to remember that many people, regardless of their ability to speak or read English, have difficulty understanding medical terminology. Therefore, using symbols whenever possible, along with medical words such as pharmacy or radiology, help people navigate throughout your facility. So if you don't have these symbols in your facility, you might want to adapt them because they're easily understood no matter what language people speak. Written communication is also important. Post signage in languages used by your patients. Don't use a lot of medical terms, and pictures help. This example sign should also be augmented with a picture of hand washing to help with understanding. And as Standard 8 Theme 2 said, if you recall back when we went over the standards, required signage should include notice of patient rights, how patients can file grievances or complaints, wayfinding signs, and notice of rights to language assistance. Translated materials should be culturally sensitive and also should be sight translated for people who are unable to read or write or who speak non-written languages. And again, you can consult community leaders for ideas and assistance. And remember, not all languages are written down. So there are people who speak languages that can't be written, or maybe they don't. Maybe they can speak the language, but they can't read it or write it. So pictures are really going to help with that communication. Also, clear clinical communication is important. This matters regardless of the language a person speaks. This chart, developed by a pharmacist, gives examples of words to avoid during clinical consultations. Even if you're using an interpreter, it's still important to use plain language. Here's an example of one side of a medication sheet developed by the British National Health Service. It's a good example of clear communication about medications. It's written in plain language and uses pictures to help convey important concepts. And it's important to always communicate clearly about health topics, particularly medication. Informational materials with pictures written at a 6th grade level in plain language are best. And then reinforce these materials with teachback to ensure that your patients really understand. And this med sheet is a good example because something like this could easily be developed and then translated into the main languages that patients in your community speak. Here's another example of something that can be adopted for use by non-English speaking patients. Here's a pill card that was developed by a pharmacist to assist her patients in knowing when to take medications at home. Notice the simple layout, plain language, and use of pictures to communicate about medications. This could easily be adapted and into other languages for use by non-English speaking patients. So as a review then, the CLAS standards are a blueprint designed to advance health equity, improve quality, and help eliminate health disparities. So why should your organization implement CLAS standards? Well, the evidence speaks for itself. There's clear and compelling evidence that cultural and linguistic competence have significant impact on improving multiple dimensions of health and healthcare. So where should you start? Well, a good starting place would be at the organizational level, which would be Theme 2, Standard 8. And this standard provides guidance on the organizational planning necessary to support the implementation of the CLAS standards. Unfortunately, many states have been slow to adopt the CLAS standards. This chart shows the states, colored in blue, that have taken the lead in adopting CLAS standards at the state level. And what that means is that those states have mandated cultural competence education as a requirement for healthcare professionals and for organizations in their states. And it's important for states to adopt these standards in order to help healthcare organizations and providers develop the supports necessary to provide cultural and linguistically appropriate care to everyone. So what's next? CLAS standard implementation takes time. Prioritize the themes and standards and start with ones your organization deems most important. Develop an implementation plan and timeline. Pick one theme, such as language access, and work on that. You can use the attached CLAS blueprint document to guide the implementation of whichever standard you want to start with. Educate yourself about culture and seek out cultural awareness training. Talk to your patients about cultural beliefs and customs and learn some words in other languages. Remember, the CLAS standards are about people and partnerships. So understanding and implementing the CLAS standards means becoming culturally aware. An important part of the journey towards becoming culturally aware is examining your organization and yourself. Know your own bias. Understand how others see your organization and how they see you. Become curious about cultures, keep talking and learning, and talk and understand your community. Remember, this is a journey. Becoming more culturally aware as both an organization and as individuals takes time. This is a journey of self-awareness and growth for our organizations and ourselves. Take the time to learn more about the people and cultures of the world. You'll be glad you did. It's been a pleasure talking to you today about the CLAS standards. For more information, please look at one of the resources above or contact me and I'll try to help you. Thank you for the important work you do every day caring for the health of the people in your communities. Now at this point, we're going to take questions.
We do have one question, Dr. Deitrick. Is it ever appropriate to use a family member to do interpretation?
No, it isn't, unless there's no other option, and I'll tell you why. Because interpretation means saying exactly what each person says. Family members may summarize, they may not know the right words, they may put in their own thoughts, and so it's really never a good idea unless the patient insists, and never ever children. Children should never be used as interpreters, but with the availability of language lines and things like that, it's the best thing is to try to use an adult who speaks the language and hopefully is trained as an interpreter.
Okay, great. And we have one more question that asks, is there a difference between regular interpretation services and the ability to get an interpreter specifically for medical issues or medical appointments?
Well, when we talk about interpreters, usually they're trained medical interpreters and they're trained to interpret in the healthcare setting, okay? And just because someone is fluent in the language doesn't necessarily make them an interpreter, okay? So even if someone is fluent in the language, they still need to be taught and trained because there are medical words and also the process. A trained interpreter will stand behind the physician and try to make themselves invisible so that the communication really is between the patient and the provider, and the interpreter is really just interpreting or helping to keep the conversation going.
Okay. And we do have another additional question. Do you have any tips for dealing with a patient with a chronic disease such as HIV who thinks God will cure them?
Well, again, that's a tough one. Sometimes what you need to do is ask them what they think God would have them do or what treatment they think would work. Okay, so if they think God will cure them, then what I might suggest is, how do they know when God is telling them to cure, when God is telling them that it's okay to get better? Okay, so some people believe God will cure them and fate is in their hands, but sometimes people can be brought to the realization that while they may feel God caused the illness or allowed their illness to happen, it's up to them to help and participate in treatment. Sometimes people look at God causing an illness as God teaching them a lesson, but it doesn't necessarily preclude them getting treated for it. But if they insist that God's going to cure them, then all we can do is try to understand what that point of view is and work with them as much as they'll allow us to.
The Florida Caribbean AIDS Education and Training Center's mission is to ensure that physicians, nurses, nurse practitioners, physician assistants, dentists, pharmacists, case managers, and other healthcare professionals in Florida, Puerto Rico, and the U.S. Virgin Islands receive state-of-the-art information, training, and consultation on the prevention, chronic disease management, and treatment of HIV and AIDS. Funding is provided by the HIV/AIDS Bureau of the Health Resources Services Administration, U.S. Department of Health and Human Services. The Florida Caribbean AIDS Education and Training Center provides a variety of HIV/AIDS education, training, consultation, and resources. Visit our website, www.fcaetc.org, to learn more. Stay in touch with us by joining our mailing and email list. You will receive notices about upcoming educational opportunities as well as new and updated HIV/AIDS resources. You may also sign up to receive our HIV CareLink newsletter. Visit our website, FCAETC.org, and click on Join Our Mailing and Email List at the top of the homepage. Be sure to also connect with us on Facebook, Twitter, LinkedIn, and YouTube. The Florida Caribbean AETC provides consultation services to clinicians in Florida, Puerto Rico, and the U.S. Virgin Islands. If you have questions related to the content of this program or would like consultation on the diagnosis, prevention, and treatment of HIV/AIDS and related conditions, we would love to hear from you. We also offer consultation on the interpretation of resistance test results. Visit www.fcaetc.org/consultation to ask your question today. The Florida Caribbean AIDS Education and Training Center provides pocket-sized treatment guideline resources that detail the federally approved HIV/AIDS medical practice guidelines, such as the adult antiretroviral therapy, hepatitis, pediatric antiretroviral therapy, adult opportunistic infections, tuberculosis, and pre-exposure prophylaxis, non-occupational post-exposure prophylaxis, and occupational PEP. In addition, we have summarized common practices for the post-exposure prophylaxis in pediatrics adolescents. We have also developed resources that provide an overview for treatment of sexually transmitted diseases in HIV-infected patients and therapeutic agents for oral manifestations. Visit our website to download or request copies of these resources. The Florida Caribbean AIDS Education and Training Center provides web-based educational opportunities to increase the knowledge and skills of HIV healthcare providers. Live and on-demand options are available. Visit www.fcaetc.org/education for more information. Florida Caribbean AIDS Education and Training Center, Project ECHO, provides a web-based didactic presentation on a current HIV treatment issue based upon current Department of Health and Human Services and other accepted treatment guidelines. Project ECHO also provides an opportunity to discuss case presentations submitted by participants and an opportunity to network with both your peers and HIV experts. All members of care and treatment teams, including case managers, are welcome to participate. Information discussed is targeted at providers with basic or intermediate HIV/AIDS treatment experience. Choose from 4 session types. Visit www.fcaetc.org/ECHO to view upcoming sessions and to register. If you're located outside of our region, the Clinician Consultation Center provides consultation services via the phone numbers listed here. Or you may also visit www.nccc.ucsf.edu for more information. To locate the AETC in your region, visit www.aidsetc.org.